So what we've got here is a diagram of a typical treatment room for radiotherapy with a LINAC in it. The LINAC is shown up here. You've got your LINAC with the X-ray head. This is where the X-ray beam is coming out of, and the patient bed. There's some other features here that I'm going to talk you through, and this is going to help you to fill out your, well, not fill out, but complete your matching activity, where you have got the features of the treatment room and kind of why we have them and how they kind of reduce the risks to the patient and the technicians that are in the room delivering the treatment. Okay, so I'm just going to talk through this quickly. To start with, looking at the entire room, you can't tell from this diagram, I've thrown this together quite quickly, so bear with me, but this room would have very, very thick walls, thick concrete walls. There would be lead in places as well, and that is to kind of treat this room a bit like a vault. So these rooms get called treatment vaults or treatment bunkers, because that is the idea. They are, when they're in use, they're entirely sealed off. This door is closed and this door is closed, and the surrounding walls are very, very thick and don't allow the X-ray radiation to escape the room, as you would hope and as you would expect, I think. So the feature that I'm going to look at first here then is through the treatment room door, through the treatment room gate, and I will talk about those a bit in a minute, but it's this strange entryway. So you've got almost a corridor here, and then you've got a turn, and you've got this really thick wall in between. And this is almost like a maze-like entry. So you're not walking straight into the room and there's the LINAC, you can see it in front of you, and if the doors are closed and treatment's being delivered, that's going on right in front of you. You're coming in to a sort of maze-like structure. As you might be able to imagine, that means you're taking a fairly long route to where the radiation is actually happening during treatment. And it just limits and minimises the amount of radiation that's going to come around here and that you might be exposed to near the treatment room door. That is just in normal usage, but also if there was something untoward going on during a treatment for whatever reason, if there was something extra dangerous going on with the radiation, you have a bit of a barrier and a passageway between you and what is going on with the equipment here. So that is quite standard to have this kind of maze-like entry into the room. So what you can't see on the diagram, but what would be in this room, is there would be radiation detectors monitoring the radiation levels in the room. So there's legislative limits to exposure to radiation for, well, the general public, treatment patients, and also members of staff. These monitors would be just continually monitoring radiation within a room, checking that it is within acceptable levels even for someone undergoing radiotherapy, and certainly technicians delivering radiotherapy. And this would just be a continual monitoring. If, for example, if a treatment room door was open, so this treatment room door here, these monitors would be able to detect this and kind of shut down what's happening very quickly. So these doors and gateways and the actual LINAC are linked up via systems that can detect if the LINAC is on and these doors and gates aren't where they should be, it will just cut off kind of activity and that would just stop. So that's obviously a safety feature. Aside from just the radiation detection, we've got portable radiation detectors will be at hand here. Everywhere in the operator's console, the person sitting here who's controlling the machine, inside the actual treatment area of the room. That is standard procedure, that there are portable versions of these that you can pick up and use if you need to. So another thing that goes on in these rooms are that the room is monitored. So we have room monitoring. So these monitors will be the type attached to walls. There will be one, the first one you would see will be visible from when you move into this door, and if the light is on, the LINAC is on. That's an immediate visual thing to tell you this dangerous equipment is operating now, and that's done with a light. If the light is on, and again, this is all about these doors, gates and LINAC equipment being linked up, but if the treatment gate is open and this was turned on, there would be a loud alarm. So again, there is a procedure before this LINAC goes on and a patient receives treatment. These gates and this door is firmly shut. If that's not the case, you have an alarm system to remind you that's not supposed to happen. So last of all, in this diagram, we've got all these red blobs. So what these indicate are emergency off buttons. As you can see, there's loads of them. They're kind of put in strategic places. So the first one I'll talk about is near this kind of beam here. So if this is the X-ray head and it is in its kind of as far left as it can be, because you remember this X-ray head can move around. We're looking at a bird's eye view, but it could move all the way around the patient to be over here. If it were over here, it would be firing this way. So what you can see is near the walls here, there's a thickening of the walls. So where the beam is going to be kind of, if it's at its far leftmost position, it will be firing precisely in this direction against the wall. The wall is thickened to start with, because this is really where the most concentrated area of radiation is going to be aimed when the head is in this position. If this head moves to the other side of the patient over here, we have it aiming at this part of the wall, and you can see the wall thickening there. At these areas, you will have emergency off buttons. If someone, there will be very, very good training and protocol in place that you avoid being in these areas while the LINAC is on. But if for whatever reason you get close, you have an off button because you are at a kind of a high risk location within the room, because the X-ray head may be pointing directly that way or that way. And as I said, the walls are thickened here as well to ensure that this radiation is not making its way out of the room. Technicians delivering the treatment, not the technician in the operator's console, but technicians are often present at the bedside with the patient while they're having their treatment. What you will have is emergency buttons right by the patient bed as well, for whatever reason, if a technician needs to quickly turn the system off. This emergency button is located so that somebody standing here can see clearly in and out of the treatment room. What that means is if someone's coming up here and they shouldn't be and the LINAC is on, they can turn it off, or if something's going on in the treatment room that they can see that means the LINAC needs to be turned off, then you've got a conveniently located button for that purpose. Finally, you've got one on your way right in or out of the room. Useful to have one there. And ultimately, you've got one in the operator's console. So these emergency switches are really useful, and there's lots of them dotted around the room. There's probably more than this. I've done a very simplified diagram for you. Okay, so what we've done there is we've run through the design features of this treatment room, which is pretty standard. These features, even if the room looks slightly different, the features will be present in any radiotherapy room. So hopefully, if you need to go through that video again, just have a look and do your matching activity so that you are clear on which feature matches with which bit of function to kind of minimise risks in the actual room while radiotherapy is being delivered.